about the fact that the NHS care regulator might not be fit for purpose. The watchdog that's supposed to go around inspecting hospitals, frankly, has not been. Many hospitals have actually gone unchecked for 10 years. That's reassuring, isn't it? Let's find out what on earth could have gone wrong by speaking to Roy Lilly, who's former NHS Trust chairman. Hi, Roy. I mean, look, most of us are lucky enough, or if we manage to get to hospital in the first place, if we can even get through with telephone tombola to our GP surgery, it's not exactly reassuring to then find out that the hospital that you might be in might not have been inspected at all, or if it's been inspected, it might be by somebody who frankly has no idea how hospitals even work.
Yeah, Max, good morning. You're right. The CQC is a basket case, and it's been a basket case for ages. It was set up by Gordon Brown, however many years that was, in response to some pretty ugly incidents in hospital of poor treatment. And at the time, in fairness to him, at the time, inspection was really the only kind of thing that they had. But, it's inspection was, I don't know anybody in industry now that does proper inspection. I mean, the nub of this is if you turn up and inspect and it's good, you've wasted your time. If you turn up and inspect and it's bad, it's too late. So inspection, the whole concept these days of inspection is totally useless. I mean, the NHS is awash with data, and it's possible now to take some of these data and triangulate it. And I could tell you myself, hospitals that are having a problem. Now, what do you do if a hospital's having a problem? Do you go along and say, oh, this hospital's got a problem, it's badly run, and then, make the whole situation worse? Staff leave because they don't want to work in that kind of environment, so they go and work somewhere else. It just makes it worse. So do you say this hospital is having a problem? What is the problem? And what can we do to fix it to get them out of the problem? So the whole concept is useless. It costs a fortune. I mean, my estimate is that since the CQC started, it's taken £230 million out of the front line of healthcare because the trusts have to pay fees to be inspected. So
let me get to the heart of what you're saying here, if you don't mind me paraphrasing. Are you saying, where Wes Streeting is saying that actually this inspector, the regulator, is not fit for purpose, he says it's a cultural failing rather than funding, and he's going to get it ship-shape again, you think it shouldn't exist at all, basically? It's a waste of time, waste of money, and actually the data that we gain from hospitals should be enough to point out if there are failings?
Exactly. I'd get rid of the CQC or call it something else, or get somebody else. I mean, they've got the guy who's going to now lead the kind of re-cosmetic branding of the CQC is Professor Sir Mike Richards. I know him. He's a very good guy. He's a cancer expert. But he was an inspector. He was the chief inspector of hospitals back in 2013. So, appointing him, it's a bit like saying to Turkey is, we're going to cancel Christmas, but we're still going to do Thanksgiving. It just doesn't work. And if you just took normal data now, if you took staff absences and churn, public complaints, deficit funding on balance sheets, and waits in A&E, you give me those 4 data points, and I'll tell you the hospitals that are struggling, and I'll tell you the ones we need to go and help. What happens with the CQC? I mean, I've kind of run a hospital. I know how this works. You hire a former CQC inspector to come in with a few people, and you run dummy inspections. They'll charge you £150,000 to come in and set the whole thing up, and then you're ready to be inspected. I mean, the whole thing is a complete farce. If CQC is supposed to do unannounced inspections, I can tell you now, the hospitals get tipped off. They know when they're coming. If you're networked properly, the whole thing has been a basket case for years. It's been badly run. And the interesting thing is the current chief executive did a bunk a couple of weeks ago, walked out with a week's notice. He just left the whole thing behind. And now they've got an interim chief executive who's clearly struggling. It's time to get rid of it. Use data. Use what industry uses. Total quality management. Get quality into the whole system, not look for faults. Look for what good looks like and share it, and people will share it and do it better.
Roy, thank you so much for your candour. It wasn't what I expected anyone to be saying today, which is get rid of the blimmin' regulator, but I hear your points, I hear your arguments, and you're right, there is data available on this. And when it costs that much money, do we really need it? Very interesting perspective. There is